And welcome back to Doctors on Call, and let's get right back to your coronavirus questions for our panel of doctors tonight. Dr. Medina, this question is for you, and it's a good one. My boyfriend drives my car to work. So when he gets home and I hop in my car to go somewhere, can I get coronavirus from sitting where he was sitting in the car? This question comes from Tressa.
Excellent question. So as was mentioned earlier, the primary route of transmission right now appears to be respiratory droplets, meaning it's spread from an infected person by speaking, coughing, sneezing. There's also a concern that you could get the infection if the virus lands on a surface, you touch the surface and then touch your mouth or nose. Right now, they've done studies and show that the virus can live up to 4 hours on copper, 24 hours on cardboard, and 2 to 3 days on plastic or stainless steel. So my recommendation is first, if her boyfriend is going to sneeze or cough, make sure he does it into his arm and not all over the steering wheel. And then if she's driving the car, make sure that she washes her hands after driving the car before touching her face or mouth.
Right. Good advice. All right, Dr. Rochester, this question is for you. If there is an asymptomatic carrier of COVID-19, how long can they continue to possibly spread the virus?
So sort of going back to that original question, the idea of virus shedding and infectivity, and we don't have a great handle on that yet. We understand that people shed virus for some time, but how long those people are infected needs to be studied a lot more. Again, I did mention that small study out of Europe of 9 people that showed after about 9 or 10 days, there was no culturable virus from these people, even though they still had high viral levels when you did what's called their PCR swab, which is looking for bits and pieces of the virus. So again, not great data. The issue that Dr. Irwin talked about and Dr. Pavlik talked about regarding the 14-day window, seems to be pretty accurate. We need a lot more data, a lot more testing to answer that question accurately at this point, but that's probably the best we can do.
All right, understand. Well, Dr. Irwin, this question is for you, and if tests have only been given to those with symptoms, how can there possibly be so many negative test results? Are there a high percentage of false negatives, or what do all of these supposedly negative people have, if not COVID-19?
As I stated earlier in the program, the false negative rate is about 30%. And so again, that has to do with people who are actually positive. They have the disease, but the test says they don't. There are a number of so if there is a case where the patient has the fever, cough, shortness of breath, test negative, it could be that they truly have COVID or one of the other many viruses that we get in the winter season,
sure.
Influenza or another respiratory virus.
Yeah, I mean, important to note that, people are still getting the other things we normally would get along with COVID-19. Absolutely. All right, Dr. Pavlik, this question is for you. And boy, we hear this a lot. Please tell everyone the correct way to wear a mask. This comes from Ann from Lancaster.
Well, what a wonderful question, because this applies all over. We see people both in public life and around in the supermarket, and they're not covering their nose, or they're covering their nose and not their mouth, or the mask is too small. And it's really critical. I mean, the purpose of a mask is to prevent you from releasing the virus through both your nose and your mouth. So you must cover both the mouth and the nose. And it should fit snugly, because if the air gets in around, or there's egress around the sides of the mask, it's not protecting nearly as well. Then you have to make sure that you are able to breathe through the mask. It should be breathable and snugly fit. We do have to use caution in patients with breathing problems, so they should talk to their doctor about how to do that. And there is a CDC recommendation for children under 2 not to be wearing masks because of potential breathing problems.
Right, right. All right, we're going to take one more break, but as we go to the break, let's take a look at some information from the state on what to do if you do have symptoms. We'll be right back after this.